turn it over to you.
All right. So Shannon, can you hear me?
I can.
Okay, good. Well, hopefully, all of a sudden, of course, that's the way technology always works. As soon as I'm getting ready to talk, the internet goes unstable. So
no worries.
We'll do the best job we can. Hey, well, first of all, thank you very much for having me on this afternoon. And Shannon, thank you for all the work that you all are doing in the public health department there in West Central. We really appreciate it. I know everybody has been learning as we go through this. There's been no playbook for how we handle a pandemic. And all of our public health departments have done a fantastic job. So I really appreciate it. What I thought I'd do today is just, of course, I always start off all my press briefings in Lincoln talking about we got to continue to follow all of our good social distancing rules, right? You want to stay 6 feet apart when you're in public. Masks, wear masks when you go to the store. Wearing masks are important. A lot of has been made that I have not been willing to support mask mandates, and that's absolutely true. I believe a better approach is by soliciting people's compliance, by explaining why we wear masks, how important it is, when to use it, that sort of thing. But, if you're going to be inside closer than 6 feet to somebody, that's a great opportunity to wear a mask because you can't do that. If you can't do that social distancing, you are more likely to spread the virus. And, at the end of the day, this is a virus that spreads from one person to another person. So wearing that mask will stop that from, almost 100% stop it. I mean, there's lots of great data that shows about people, both parties are wearing masks, the transmission level is close to zero. So it really is an important tool for us to be able to use. And then, of course, there are other things about washing our hands, avoiding crowded bars and restaurants. Those are all things that will also help us slow the spread of the virus. And then, of course, we want to make sure we continue to support our 6 pillars, too, here at the state level. And I'll just briefly get into that. Testing, we want to continue to make sure we're doing robust testing. We've been ramping up the capacity or working on ramping up the testing capacity at Test Nebraska. We're planning on taking our capacity up from 3,600 tests a day to process, to be able to process 7,000 tests a day. We're hiring people. We've got a team that's looking at how we can improve that throughput, and we will see the benefits of that. Right now, Test Nebraska is making up about 60% of all the tests that we're doing here in the state. Last week, we had about 30,000 tests, and on Test Nebraska was over 18,000 of those. Then the kind of follow-on to testing is the contact tracing, and that's where we've got, we've actually dropped down from about 1,002 people down to about 970 some people because we're switching vendors right now, but we will get back up to robust testing, over 1,000 people. We've got robust testing capacity right now. Right now, we're only using about 400 contact tracers. But we want to make sure we've got lots of capacity, especially as we look at schools coming online, to quickly get on top of that contact tracing. And right now, we are reaching out to 95% of people the same day we get that test result back and getting a hold of about 45% of them. And we're also getting back to those close contacts within a day as well. So we're really got that robust contact and tracing ability to be able to assist our local public health departments in making those contacts and getting those people to isolate or quarantine. I think that's another point I just want to make real quickly is, look, if you've had close contact with somebody who is just got symptoms and they ultimately test positive, you can't get out of your 14-day quarantine period by testing positive, right? If you have to wait for that incubation period, which we think is about 14 days. So if you've been in close contact with somebody who's had symptoms, who ultimately tests positive, then you need to make sure you're waiting those 14 days. You can't go to a Test Nebraska site, get tested, and think, oh, I'm negative, I can go back to my regular work. No, it doesn't work that way. You have to wait those 14 days. So I do want to emphasize that as well. We're also continuing to work on our quarantine space, making sure we got robust supplies of personal protective equipment, working on our plans for all of our at-risk communities like long-term care facilities. I know a lot of schools, especially right now, are doing a lot of work. We're continuing to make sure we monitor our food processing plants and so forth. So a lot of those places, again, where you have close concentrations of people, that's where the virus can spread. And then ultimately our directed health measures are out there as well to be able to help provide that guidance. And we appreciate everybody's cooperation on following those directed health measures. Those are very important for us to be able to manage this virus. And ultimately, all this goes into making sure that we are protecting our hospital capacity. And we've been able to do that very, very well here in Nebraska we have about a little less than 150 people in the hospital today. We've got 36% of our beds available, 36% of our ICU beds, and 80% of our ventilators. So we've got robust hospital capacity in the state here today. So that's kind of a quick overview from the state's perspective. And again, Shannon, thanks so much for all the great work that you're doing there in West Central. We really appreciate all your great work, and certainly I'll be available here. I've got till about 5 o'clock or so to be able to answer any questions that come up.
Thank you, Governor, so much. I appreciate it. And we appreciate all that you do as well.